2NURFM 103.7. Normally at this time we catch up with Claire Collins from the University of Newcastle. However, she has subbed in today, Rebecca Haslam from the University Nutrition and Dietetics. Rebecca, as always, thank you for coming in. Of course, you were volunteered today, so did you get much of a choice or it was just like your turn?
Whenever Claire can't do it, she delegates, and today it was my turn.
Fair. Everybody else, they were looking for somebody to volunteer to step forward. While you were hearing the question, they took a step backwards, yeah?
I always seem to be the main one that's still standing forward.
How does that work? All right, today we have something in and around the university for bowel cancer. So last year, how many cancer diagnoses can we attribute to bowel cancer?
Yeah, so we know that over 10% of all cancer cases that were diagnosed last year can be attributed to bowel cancer. So we know that it's a topic that we really need to talk about.
Yeah, so a decent chunk there. What are some of the risk factors that would be something we need to keep in mind?
Yep, so there's not a lot we can do about them. So being over 50 years of age and having a family history of bowel cancer are risk factors. But there's also some that we can change. So we know that diet plays a big role. Some foods increase the risk and other foods decrease the risk.
So what are some of the main ones that can potentially highlight their risk and a couple of good ones at the other end?
Yeah, so particularly looking at red meat and processed meat and then alcohol. So they're our main ones that are contributing to increased risk of bowel cancer. And then on the other side of it, looking at whole grain foods, high fibre foods, and even dairy can reduce the risk. Okay,
the dairy reducing, that's good to know. So it's not always a case of all the stuff we like the most is in the bad column and all the stuff that we really don't want to eat is in the good column. So it's good.
Yeah, absolutely. And sometimes it's just more about limiting foods rather than excluding them and getting rid of them altogether when we're looking at those foods that increase the risk.
I'm sure many will be glad to hear that,
yes.
Rebecca. All right, so take us through the study. How is it going to work? Who are we looking for and how long?
Yeah, so currently we're recruiting patients who are actually scheduled to undergo colonoscopy. So if there's any individuals out there that have been scheduled in, then they've likely received a letter in the mail asking to participate in the study. So we're looking for people essentially that are going for colonoscopy and then they come into the study if they want to participate, and they get randomised across 3 different groups and different levels of personalised nutrition support. So our top intervention gets a personalised nutrition report from the Australian Eating Survey as well as a consult with a dietitian. We try to focus on those foods that increase and decrease the risk and then see if we can reduce bowel cancer risk over time.
And who knows, you might through all of this might even pick somebody up from being in that 11%.
Yeah, absolutely. And if we can do that, then we know that we're doing a really rewarding job.
All right, a big tick for you, Rebecca. You survived.
Wonderful.
Survived coming for Claire. Some great advice there. So if that is you, keep that in mind for bowel cancer and colonoscopies. From the University of Newcastle, Rebecca Haslam, thank you so much for your time. Appreciate it.
2NURFM, a broadcast service of the University of Newcastle.